Good morning. My name is Veronica, and I will be your conference operator today. At this time, I would like to welcome everyone to the Respiratory Care Principles and Practice 3rd Edition conference call. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. If you would like to withdraw your question, press the pound key. Thank you. I would now like to turn the conference over to Grace Richards. Please go ahead, ma'am.
Thank you, Veronica. Welcome, everyone. I want to thank you for joining us today. Today I have with me our editor, Rhonda Dearborn, as well as one of the co-authors of the text, William Galvin. I'd like to tell you a little bit about the 3rd edition and a little bit about the editors, and then I'll introduce Bill, and he will talk about the content of this new text as well as some of the features. We're very excited to just release the 3rd edition of Respiratory Care Principles and Practice. This text now includes our Navigate 2 resources, which include an ebook. So not only will the students get this wonderful, beautiful, hardcover, full-color 520-page textbook, each textbook also includes an access code for an ebook as well as some wonderful online resources. I'll tell you a little bit more about those resources later in the presentation. But we're really excited, especially with such a large text like this, to be able to offer the ebook at the same price. I think it's going to make it really nice for students to have the textbook at home and be able to study with that and maybe take an iPad into the classroom or their laptop and access the ebook so they're not carrying around the textbook all the time. So this is the 3rd edition. We're so excited to have released it. Anyone that has requested a review copy, those should be out shortly. If you haven't, you'll be able to do that, and we'll tell you how to do that a little bit later in the presentation. And I wanted to talk a little bit about each of the editors. We're very excited to have this wonderful, well-known author team. All 4 editors are fellows of the American Association for Respiratory Care and also have fellowships in additional medical associations and societies. These editors have served or are serving or have served on executive boards and committees for AARC and as well as additional medical association groups. They all have experience in respiratory care, including clinical, research, teaching, and administrative responsibilities. And each has authored and reviewed numerous articles, chapters, books, case reports, and original research studies. These editors are all frequent presenters at local, state, regional, national, and even international meetings. And they have all received numerous awards, distinguished honors, and recognitions for their contributions in the field of respiratory care, as well as teaching. So we are just very pleased and honored to have worked with such a distinguished and talented author team. In addition to the hard work of these 4 editors, the 3rd edition of Respiratory Care Principles and Practice has also included contributions from an additional, over 70 additional experts representing really the very best in clinical and academic expertise in respiratory care. A little later in the presentation, you'll actually see a table of contents with the chapter contributors' names listed. And now I'll just share a little bit about each of the editors. Dean Hess, lead editor, is Assistant Director of Respiratory Care at Massachusetts General Hospital and an Associate Professor of Anesthesia at Harvard Medical School. Dean is also the Editor-in-Chief of Respiratory Care, the official science journal of the American Association for Respiratory Care, AARC. Neil McIntyre is a Professor of Medicine and the Medical Director of Respiratory Care Services at Duke University Medical Center. Shelley Mishu is Dean of the College of Health Sciences and a Professor of the School of Community and Environmental Health at Old Dominion University. And joining us today is William Galvin. Bill is an Assistant Professor at the Francis M. McGuire School of Nursing and Health Professions and an Assistant Professor in the School of Allied Health Professions, as well as Director of the Respiratory Care Program and Administrative and Teaching Faculty of the CHIPS Program at Gwynedd Mercy College. And I'd like to welcome Bill now and thank him for joining us. We're so happy to have you here today, Bill, to talk about the content of this text and some of the features of the 3rd edition of Respiratory Care Principles and Practice.
Well, thank you very much, Grace. I really appreciate the introduction. I want to begin by saying some thank yous. First of all, I want to thank Grace and Rhonda very much for their assistance in staging this event. We're obviously very, very excited about what we have for you, and I also want to thank my colleagues and friends who are listening in for either adopting the book or considering to adopt the book in the future. We hope we have something that you really enjoy, and I join you with considerable excitement. I also want to say that when I arrived on campus on Monday, there was a box sitting on my desk. When I opened it, here it was the book. So I can't tell you how excited I was to see that and to be able to talk with you a little bit about it. What I'm going to do is jump right in here and get started. If we take a look at that slide, the first slide, it says key content and coverage and correlations. And I want to speak a little bit about that. Just to sort of set the stage for what happened was prior to the rewrite of the third edition, we had a little bit of a brainstorming session, and we talked between ourselves and tried to decide what we thought were the hot topics and what are some of the things that are must-haves, if you will, for the book. And so these highlighted items, these bulleted items, do in fact represent that. So let me go through them with you. The very first one there is the 2015 NBRC competencies. And as you well know, the NBRC just recently came out with a new matrix and also with a new exam. We now have the therapist multiple choice exam, which will have two different cut points, one for the CRT credential and the other for the RRT credential. And then we will also have the new clinical simulation, which will consist of 20 cases instead of the 10 that we had previous. So with that new matrix and a new set of detailed content outlines, we felt that we needed to share with our contributors and our editors the fact that the changes were underway, and we wanted them to be mindful of that. So we're going to make sure we incorporate the matrix and the detailed content outline in and throughout the book. The second item that we have there is that AARC clinical practice guidelines. And as many of you know, these are really the guidelines that are driving the science behind what we do. And so we were very mindful of that and made sure that in virtually every case, wherever we could, we made sure that we incorporated the clinical practice guidelines. And one of the things of particular note is the fact that the editorial team was heavily involved in this project. Many of you know that Dean was at one point the chair of the Clinical Practice Guidelines Steering Committee, and the rest of us actually were involved in either writing or reviewing various clinical practice guidelines. So I think we provide a little bit of expertise and experience in those areas as well. The third and the fourth bulleted item that you see there is the patient safety and protocols, and also the ventilator and associated events. And as many of you know, these are critical issues that are all respiratory therapy departments are facing. So we made sure that we were mindful of that as well and some of the directives that are coming from the Joint Commission with regard to patient safety. So there is, in fact, an entire chapter that we devote to that. The chapters dealing with pneumonia and other events and infection control will obviously also talk about some of the infection control issues and the ventilator-associated events issues that we have to deal with in the profession. The next item is the patient education bulleted item, and this is of particular interest to me because I was actually the author of that chapter. And when we did have our discussions, we did decide and address the fact that this is going to be a major influence in the healthcare system of the future because there seems to be that big movement in terms of self-care and self-management that we need to impart on all of our patients. And so this patient education chapter and the patient education topics that are sort of embedded throughout all the chapters is really something else that we felt that was very important. The next item is the critical thinking bulleted item. And again, those of us who've been involved in respiratory care education know full well how essential the critical thinking skills are. So again, we made sure that all of our contributors were aware of that. Once again, the idea of the 2015 and beyond initiative and the consensus conference was highlighted by stating that critical thinking was in fact a major skill that we need to have embedded in our students. So between that and the NBRC credentialing process, we felt that they really do highlight the fact that critical thinking is such an important part. So it's something that we have embedded in there. And you'll see in just a few minutes that there's a particular feature that we have in there that's going to address that. The prevention of readmissions is something that's near and dear to all of us right now because, as you well know, most respiratory care department directors and CEOs at hospitals are very aware of the fact that there is going to be a penalty and as well as a reward system set up in the future that deals with 30-day readmission problems, and there are certain diseases that have already been highlighted and those that are going to be highlighted in the future. And basically, if patients are readmitted within the 30-day period, there's going to be penalties instituted on those institutions. So the problem, of course, is to make sure that this doesn't happen. And so we made sure that all of the contributors were once again aware of that, and you'll find that certain chapters really do highlight that feature more than others. And then the last, and perhaps not least understood, is this Affordable Care Act. There's obviously a lot of uncertainty with regard to what's going to happen with the Affordable Care Act, but we do know that there are certain things in play and certain things that we need to be aware of, and there's this tremendous emphasis on the shift that's occurring in terms of self-management and health promotion and disease prevention and pay for performance. Again, some of the issues regarding the readmission, all of those are variables that are very highly influenced in the Affordable Care Act, and so once again we made sure that all of our contributors were aware of that. The chapter that dealt with healthcare economics, for example, does speak to some of those issues in a more pointed way. So that takes care of that first slide that we have there. I'm going to move on to the next one, which is entitled What's New in the Third Edition. And you'll notice that in the first bulleted item, there's 5 chapters that we have highlighted there. The first one is the ECMO chapter, which is brand new to the book. And once again, because of its increased popularity, we felt that that was something that we needed to add to the book to increase its richness and its value. The following 4 chapters actually are kind of interesting because we had one large comprehensive chapter which we entitled Cardiopulmonary Anatomy and Physiology, and that's what we had in the second edition, and we listened very much to the audience and to many of you who indicated that you wanted to see a little more of embellishment in that. So what we did was we broke that chapter down into 4 chapters, and so what you'll see there is an individual chapter on respiratory anatomy, one on respiratory mechanics, one on the control of breathing, and then a final one that deals with cardiovascular, renal, and neural anatomy and physiology. So that's a new feature to the book, and I think it's something that you're going to like. The next bullet item talks about the user-friendly nature of it, and we really did try very much to make it a very readable book so that the students will be able to enjoy it and follow it. And we took every option we could to make sure that the user-friendly feature was there. There's an expanded, revised, and enhanced resources. So what we did there was to go back, especially with the chapters that were coming back from the second edition, we made sure that the currency was there. So we made sure that we looked at all the resources to make sure that everything was up to date and it was representing the state of the art. And then the last feature there was the 580 photos and illustrations and the 240 tables and equations. So it's a pretty robust number of visuals. And a lot of us had discussions about this prior to the writing, indicating that we really wanted to speak to the visual learner, which many of our students are, so we felt that this would really highlight the readability of the chapter and really enhance the teaching learning process. The next slide deals with the chapter features. And basically what we did here was we wanted to represent a rather detailed but a very systematic and sequential way of presenting the material to all of us. And so we adopted this sequence where we started off with the chapter outline, followed by learning objectives, followed by the key terms, and then we had some special things we called boxed features, which we're going to talk about in just a few minutes, and then equations, the clinical practice guidelines, the key points, and of course the references. So I'm going to talk a little bit about each of those in a little bit more detail and perhaps give you some examples so you could take a look at them and see how we've implemented them in the book. The next slide, there's a series of slides now that talk about the table of contents, and I wanted to sort of set the stage by telling you that we organized the book into 5 different sections. Section 1 was respiratory assessment, and then we have the next one that deals with respiratory therapeutics, another section on diseases, a 4th one on the applied sciences, and then the last one we entitled respiratory care profession. And so I won't read those to you because I think you could take a look at the chapters and see how they're divided up. But we tried to put them into that kind of an order so that people can very easily make access to them as they were needed. I'm going to skip ahead to I guess about 3 or 4 slides ahead, and we're going to move up to the areas that do deal with the pedagogical elements. But let me just mention real quick that the last 2 chapters in that table of contents, chapter 59 and 60, were particularly important to us because we didn't really find that there was too much out there with regard to healthcare economics. And so that's a kind of a unique chapter that was developed to really speak to the issue of our practitioners needing to be more aware of the reimbursement issues and the healthcare economics that are going on in the system. So we felt that was kind of a unique feature. And then the last one was the respiratory care research, which really does speak to the needs of the 2015 initiative and the growing movement in the direction of the baccalaureate degree. And so finally, the last one is the evidence-based practice, which was done by Dean. And again, a very, very important chapter that deals with the science that's behind the whole issue of what we're doing here with the book. The next slide deals with our pedagogical elements. And once again, we tried to be very systematic and methodical in the way we presented these because we wanted to follow a particular teaching learning process. And so you'll find that virtually every chapter will have each one of these elements addressed, some with more detail than others, but basically we're going to start off with an outline, followed by objectives, followed by the key definitions and terms, and then there'll be an introduction, and then we have some of the boxed features, which I'm going to talk about in a little bit more detail in just a few minutes, and then you can see the equations, the practice guidelines, case studies, key points, references, glossary, and finally the index. So let me spend a little bit more detail, a little bit more time talking about each of those, and I'll kind of walk you through with examples some of the things we're talking about. The next slide does have a heading of pedagogical elements, but the items on the left will talk about the outline, the objectives, key terms, and introduction. And to the right of that, you'll see there's an example of that. I chose the patient education chapter, which is the one that I wrote, but you can see if you peek at that slide that it starts off with an outline. Now, the outline is a very general content outline, and throughout the book, you'll find that, throughout the chapter, rather, you'll find that we break that into a more detailed content outline, and there's more detail, of course, embedded within that. And then under it, we have the objectives. This one has somewhere in the area of, I think, 13 or 14 slides, or 13 or 14 objectives. And then that's followed with the key terms, which you're going to see as being italicized throughout the chapter. And then finally, the last one on that page that deals with the introduction. And so what we try to do with the introduction is to sort of set the stage for what it is you were going to see in that chapter. It was kind of an overview of what it is you're going to be reading. But again, that's the way you'll find each one of the chapters will have those elements in it, and that's the way the chapter will start. Moving down to the next slide, the boxed features that we alluded to earlier. The first box feature that I have listed here is what we call respiratory recap. And basically, these are real points of emphasis, things that we think are really critical for the learner. So we actually wanted to go back and kind of revisit them by highlighting them in what we call a respiratory recap. And you can see the example that I have there deals with the chapter on patient education and communication skills. And as many of you well know, those 6 elements there are really considered to be key strategies whenever you're having an interpersonal interaction with a patient in terms of communication, and things that are highlighted, especially when we talk about literacy issues. The next slide is once again boxed features, but this again is something that we think is pretty unique. We're calling it Stop and Think. And we had the little caption there to bring attention to it. But basically what we're doing here is we're trying to get the student and the reader to take a moment and to ponder on a thought-provoking type question that is related to the topic that's being addressed in that particular portion of the chapter. And once again, this is taken from the chapter on patient education, where we're talking about communication skills, and you'll see that the example that we says perform a literature search and identify 3 or 4 distance zones. And what we're looking for the student to do here is we've obviously just talked about the issues of communication and interaction, and we're trying to get them to be thinking about the actual encounter that they have with the patient. So in the literature, you'll see that there are different distance zones or space zones, and what happens when we cross over that point and we start to invade space. So once again, the student is being asked to stop what they're doing at that point in time and to do a literature search and to try to get a little bit more detail about it. So again, the emphasis once again is to get the student to go dig down a little bit deeper in something, a topic, and also to get a kind of a richer understanding of the concept that we're talking about. The next slide down talks about another boxed feature which we call age-specific recaps. And again, this is going to provide unique differences, if you will, between the various ages. So when you get to chapters such as the gerontology chapter, for example, which is the example I have here, you'll see that there are differences, obviously, that occur across the generations in the different time spans. And so chapters such as that, or chapters dealing with neonatal or pediatrics, probably lend themselves very well to this kind of a pedagogical element. But the example I have there is right out of the gerontology chapter. The respiratory care of the elderly is the title of it. And you'll see it says, whereas the half-life of Valium is, in a 20-year-old, is approximately 24 hours. In an 80-year-old, that is approximately 82 hours. And again, the idea there is to highlight the differences that you see between the various ages. Moving on to the next pedagogical element, we have equations that are embedded throughout the chapters. And while this may not be the most exciting and appealing equation that you will see, it does speak to the issue of the ideal gas laws. And obviously very, very important in terms of how the gases behave and the things that are very important with regard to pulmonary diagnostics and other things as well. But I did provide the ideal gas law as an example of that, and you can see it's highlighted there on the right-hand side of that slide. And then moving further down to the next slide, we have the clinical practice guidelines. And as I mentioned before, this is a very, very important feature, we feel, because it is really the science behind what we do in the profession. And so in virtually every case, wherever there's a clinical practice guideline that has application to that particular chapter, we made sure that we put it in the chapter so that the person can actually review it. And the example I have here deals with the aerosol delivery devices, and it's a relatively short one, but as you well know, when you get into some of these other chapters, some of them are 1 or 2 pages in length with considerable amount of detail. But again, they're pretty scattered throughout the book, and we've tried very much to make sure that all of them are covered and represented in the book. The next one is the pedagogical element that deals with case studies. It's going to be, you'll see that this is covered both in the textbook as well as in the instructor's manual. The example that I have here is taken from the ethics chapter, and it's case number 6, and it's entitled "You Can Tell Mom." And obviously, the individual is being faced with a dilemma and a situation where a patient is being asked to give information regarding a family member, and the issue of confidentiality is obviously the things that we're talking about. But all, again, throughout the book, you'll find that there are a number of cases that are embedded in the chapters. Some of them are with regard to various disease states, which again lends strength and learning to the process, and some of them, as exampled here, are in the areas of ethics. The next slide deals with key points, and once again we've tried to be very systematic in our teaching process and follow a lot of what Bloom has talked about with regard to telling the people what it is they need to know in the form of objectives, and then giving them the material and the content through the script, and then ending that by coming back and revisiting it in the form of a summary. So our key points really are just that. We're actually going back and revisiting and highlighting the things in the chapter that we felt that were very prominent for individuals to know. And again, I think you'll find that that will be very helpful as well. The references, I think they're very straightforward. I think we're all pretty comfortable with that and realize what they are, but I did want to highlight the fact that we were very mindful of the fact that when we went from the first and the second and now to the third edition, we wanted to make sure we went back and revisited the material and made sure that it was current. So currency was important to us, timeliness was important to us, and making sure that we had material that was state-of-the-art. And so you'll find that the references will be helpful in terms of getting more detail if you wanted to kind of dig down deeper and get more information about a particular topic. The following one deals with the glossary, which again are pretty straightforward. I think we've all worked with those before, so there really shouldn't be any issues. But towards the latter part of the book, we have those listed there. And again, in the beginning of each chapter where we have the key terms, they're the key terms that you're going to see listed in the glossary. And so the individual can go to the back of the book, of course, and to see that and to follow it. I did not list the index on the slide because I think it was pretty obvious, and so that's something that I kind of skipped over. But we, from there, we went on to the Instructor Resources, and I'll kind of start this and maybe ask Grace and Rhonda if they want to pipe in and pick up on this themselves. But you'll see that the beginning of the slide just goes over a very general listing of all the different instructor resources that we have. These are very, very critical, obviously, and things that people have been asking us for, so we made sure that we responded to their needs and developed these kinds of things. But the instructor manual itself is something that is very, very detailed, and we feel is going to be very, very helpful to the instructor. And there'll be a lot of material forthcoming with regard to that. The transition guide is going to show you how you go from the second to the third edition in terms of how we made the changes and how the content was being addressed and covered. And we have that represented in a slide that will show you the difference between the two. The conversion guide is something we're putting together that deals with other textbooks. So if you're moving from one textbook to another, you'll see that we have highlighted for you where it's located in each one of those publications. So it'll be easy for you to follow that as well. And then sample syllabi, something that we did for individuals that we felt was useful in terms of giving them some general ideas of how a course, for example, is developed and what a typical syllabi might entail, and then listing, of course, the page numbers and where they could find that various material listed. The slides in the PowerPoint format are something that we're going to be extremely robust with. I think you're going to find that there's quite a bit of detail on those. In years past, we've made them very general so that individuals can sort of tweak them to fit their needs, and I think you'll still be able to do that, but I think you're going to find that they're clearly more robust and there's more detail on them than we've had in the past. And then, of course, the last one there is the test bank, and again, each chapter is going to have a test bank, which has quite a number of items listed there for you, so we've tried to do as much of the homework for you in preparation and help as we possibly could. So I'm going to kind of quiet down here a bit and let Grace and Rhonda pick up on this and move forward, and we'll have some time at the very end to answer any questions that you have as well. But once again, I'll conclude my portion by once again thanking all of you so much for listening in to what we have, and again, just this tremendous excitement that we all have about the book. It's really something that we're really happy with. So, Grace, I'm going to punt the ball over to you.
Great. Thanks, Bill. That was a fabulous overview. I really think that the third edition, you've all really enhanced it, made it even more student-friendly with all the great chapter features, as well as the great instructor resources. The PowerPoints have all been revised and updated, as well as a new test bank with additional questions. And to talk a little bit about the student resources and instructor resources, I wanted to talk about Navigate 2. As I mentioned earlier, each textbook comes along with an access code to log into an account for both students and instructors. The students can access an eBook as well as a practice center with practice activities and flashcards, an assessment area with quizzes and examinations, and the instructors can take a look at a grade book that auto-populates grades from the quizzes, as well as some reports on student usage and even plotting kind of where your students stand on kind of an average basis, who might need help and who might be excelling. So just to give instructors a real good look at their students and how they can help them. So our Navigate resources will be available in June. They're still in development. Anyone who gets their textbook, the students can log in with their access code, set up an account, and we hold on to their email addresses and we'll let them know when the resources are available. So definitely for fall, everything is going to be all set. This is our learning management system. It's based in Moodle, a Moodle platform. It does integrate with other learning management systems, such as Blackboard and additional systems. And we are going to be offering training sessions for instructors and demos just to show you this system. Once you've adopted the textbook, we'll set you up with your instructor course code and your instructor account, and we'd love to show you these tools specifically and how you can tailor them for your specific course. And I'll talk a little bit about that as I show you what some of it looks like. I think I talked about everything that's involved in the package, the eBook, the study tools, the assessments, all preloaded. There are chapter quizzes. There's even a midterm and a final exam that are preloaded. And you can customize these. You can change the questions. You can add more of your own questions. You can create your own quizzes. But we do have preloaded content in here so that it is all ready to go. And as I mentioned, we do provide a lot of onboarding and training. So this is the home page of our Navigate To system. As you can see on the left, there's a calendar, and any deadlines or assignments that instructors put in, they'll show up on this. Students can put their own reminders into the calendar. And then the main section over on the right here, there's a lessons pathway and a learning tools pathway. In the lessons pathway, the students can access the chapters for each of the books. And as an instructor, you can actually, in your editing mode, drag and drop these chapters into a different order. So if for some reason in your course syllabus you want to cover something at a different point in time, you can actually customize this online course, if you will, to meet the needs of your course. And we can show you how to do that. Just to give you an example of what an ebook looks like, this is a different ebook, but just to talk about some of the tools. So students can flip pages with the arrow keys or even by clicking on the page. There are different highlighting, underlining sections. Students can add little notes. It will pop up like a little Post-it note. They can add a note. They can even add a voice note, an audio note, which is really kind of interesting. And as an instructor, you can actually add audio notes into the main ebook that your students will see, or post notes for your students to see, or highlight a certain section, like this might be on Friday's quiz, etc. Students can also access the table of contents. They can bookmark pages. They can search the glossary, etc. And to talk about the learning tools pathway, students can come into here and get right into the study center. If they wanted to take a look at flashcards for chapter 1 and 2 at the same time, they can access all the study tools under this section. In the ebook section that I showed you earlier, under each chapter, there are specific flashcards, learning objectives, etc. And students can also access the quizzes directly through the assessment area. And just to show a few examples of the different types of questions, with the ebook, there's a lot of technology that's really great to embed right within the ebook. And as students are reading along in their ebook, we have little green icons that will put in a knowledge check question. So after they've read something, they can be quizzed on it and assessed. Some of the different types of questions might be a multiple choice question like this. It could be a drag and drop or a matching question. I also wanted to show an example of a flashcard. This is from a different text, but it would show the description, and then the students can type in their answer up at the top and check their answer. If they're not sure, they can click check answer, and it will give them the definition, and these make great study tools. And then for the instructors, we have a whole gradebook section. As I mentioned, the pre-populated quizzes, the grades will flow right into this section, and you'll be able to see your students' progress. I also wanted to talk about another product that we offer, which is a respiratory therapy exam preparation guide, and you would be able to package this with your textbook and Navigate Resources as well. So as you're speaking with your account rep, if this is something you're interested in, we can also offer you that. And this test prep, if you will prepare students to take the NBRC exams. So if it's something that you'd like to include as far as coverage in your course, we can provide that bundled in with this text and Navigate package. And I would like to turn it back over to Bill just to do a quick recap, and then we'll take some questions.
Well, thanks, Grace. Appreciate it. That was very well done. I really appreciate that. I'm going to bring your attention to the recap features that you see on that next slide. And again, I don't want to be overly redundant, but we did want to highlight the fact that there were certain things that we felt were very, very important, and we wanted to make sure that we brought that to your attention. We do include an update of the content related to the 2015 NBRC exam matrix, and so that was something that was very important to all of us, and we wanted to, again, make sure that our contributors were mindful of that and that they were incorporating those elements in there. The following of the clinical practice guidelines, I think, is extremely important, obviously, and we made sure that we did incorporate all of those throughout the book whenever there was any pertinence at all to the particular chapter, and so they're right there for the reader. was written by over 75 expert contributors in the field of respiratory care, and we felt that we have identified some people who are very prominent and, people who really were experts in their areas. And so we handpicked everyone, and we were very careful in the selection process and made sure that we had people who we really felt that could provide the level of experience and expertise that we were looking for. Providing accessible, student-friendly content. Again, it's always very tricky to actually write a book and make sure that it has the same pen behind it, but fortunate for us, Dean was the one who was the final editor of virtually the entire book and all of the chapters, and so if there were any modifications that were needed, we had a chance to do that before it went to final print. But the intent was obviously to make sure that it was something that was very readable to the students and friendly for them, and we feel as though we've accomplished that. The 580 photos and illustrations, 240 tables and equations. Again, it's very rich with regard to material that is highly visual in nature, and many of us felt strongly that that's really what our students are looking for. And I know that even when I talk with my own students here, that idea about a picture's worth 1,000 words, it rings through so prominently, and that whenever you can put pictures and graphics and illustrations and things, I think it does enhance the learning tremendously, and so we feel that's really something that's very strong and represented in the book. And then finally, the textbook and the eBook packages, something that's constantly under revision and being changed, and the folks at Jones and Bartlett are really very, very good at that, and you can see that there's been a richness added to that as well. So we're very, very happy with it. We're very, very excited, and we hope that you'll find what you're looking for, and if there's any questions, certainly we'll be happy to do that. So, Grace, I'll take it back to you again, and if people want to, send questions in, certainly we'll try to answer those for you.
Great. Thanks, Bill. And thank you so much for all the details about the book that you've provided, and thank you for all your hard work. You, along with the other editors and contributors, have really put together a terrific package here. I think we have everything that a student and instructor would need to be successful. So we're very excited to hear everyone's feedback as they're receiving their texts and reviewing them and considering them for course adoption. I'd like to thank everyone for joining us and flow into our question and answer session. And I will ask our operator, Veronica, to step back in and help us with that.
At this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster.
You can also type in questions in the chat box on the right-hand side of your screen.
And you do have a question from the line of John Holloman.
Do you guys plan on adding anything like videos, short videos to your website? I know you got the illustrations or whatnot, but it's kind of like short videos to drive the points home.
Yes, that's a great question. We do have some animations that will be included in the Navigate section, and I'm actually in the process of putting together a website to show some of the features of this book and allow you to preview some of these animations. Along with the recap after this presentation, anyone that's attended, I will send the PowerPoint slides as well as a link to view this recorded video. And I'll send a link to that website where we're going to post some of the animations that you can take a look at. So those are forthcoming.
Okay, thank you.
John, I just want to pop in there and say that I think you're right on target with that. There is really an interest in adding more and supplementing books and publications with such items, and so I think that's really a good feature. And as you can see, Grace and the folks at J&B are actually working on that as we speak, and so I think that's really going to help considerably.
Okay, thank you.
Oh, you're welcome, John.
And there are no further audio questions at this time.
Okay, I'll wait just a minute to see if anyone else jumps in with a question, either by pressing *1 or entering a question in the chat box on the right. But I did want to also just reiterate that anyone that has signed up for the webinar, even if they couldn't attend, I will follow up with an email including a link to view this recorded webinar. Also to be able to download the PowerPoint presentation from this webinar. And as I mentioned, to take a look on our website for more information and previews of information in the text. We'll have some different images and those animations that I mentioned, as well as a conversion guide. If you've used the second edition and you're transitioning to the third, we have a transition guide for instructors. We even have some conversion guides if you have used a different text. And I also wanted to offer to instructors, just thinking back to the second edition, we received a lot of great feedback that students really loved the second edition, and we're assuming and hoping that they will love the third edition as well. But we had some instructors take a chapter from Respiratory Care Principles in Practice in another text and just kind of give it to their students and see what they think. And we had one instructor come back to us that just had wonderful things to say, and we asked to use a quote that, you know, his students really loved this textbook better than any other one. So we hope that will be the same for the third edition, and we offer you that opportunity as well. If you'd like to take a chapter or two and use it as a kind of a test or an analysis in your class, we're open to that. We're happy to provide any information that you might need to transition from the second edition or from any other text. So we love hearing feedback from instructors, and we're really excited to provide the training on the Navigate resources, which are really easy to use, as the icons are pretty intuitive, and it really will allow you to kind of customize the online resources to your course. So I'll just check in with Veronica again, see if there's any questions.
This is Rhonda. I just wanted to chime in. Rhonda Dearborn, I'm the editor for Respiratory Care. I just wanted to chime in and follow up on what Grace said about the animations. We have a large number of animations that are being prepared for the eBook in the NAV2 package, and I'd say there are a minimum of at least 25 animations that will be included. So I think that it will lend a lot of interest, aid in learning, and add to the overall approachability of the content, because it will appeal to different types of learners. So I do think that that's a big piece of the puzzle.
Thanks, Rhonda. As well as this text, as we're closing, I just wanted to share with instructors 2 other texts that we published in Respiratory Care just recently. One was Equipment for Respiratory Care, and the other Patient Assessment and Care Plan Development. So we're really rounding out our resources for respiratory care. If you want to take a look at all the texts that we offer, you can go on our website and easily access that by the URL go.jblearning.com/RC for respiratory care. And I will also provide here the link to view that website that I mentioned. We're going to put up some sample images and animations, and that link will be go.jblearning.com/RCPP3E for Respiratory Care Principles in Practice 3rd edition. And I'll send out more information about that. You can go to our book's catalog page to request a review copy or the Instructor Resources. And if you need to contact your health professions account specialist to request a copy or set up a training session, or if you'd like a demo of the Navigate 2 resources, we're happy to do that. You can contact your rep at go.jblearning.com/findarep or call us at 800-832-0034. And again, I want to thank everyone for joining us, and I want to thank Bill Galvin for that fabulous presentation. We're really excited about the 3rd edition of Respiratory Care Principles in Practice, and we look forward to hearing your feedback. Thank you, everyone, for joining us today, and thanks again, Bill.
Oh, you're welcome, Grace. Thank you, and thank you to everybody that's listening as well. I do hope that what we have here is something that will really help you in the development of your students to become a respiratory therapist, and thanks.
Thank you.
This does conclude today's conference call. You may now disconnect.